Well, we just finished the IDR course, and all I can say is that Dr. DeRosa, Dr. Marcos, and Dr. Violin basically blew it away, just completely hit out of the park, exceeded my expectations, and let me tell you, my expectations are pretty high. And when I invited Dr. DeRosa to, in essence, take his IDR course on the road as a team, and the team meaning not just the surgical phase with diagnostics, but the restorative phase and the biology, the science of what IDR is all about. It was all here thanks to the three gentlemen. And judging by the feedback, immediate feedback on a daily basis from all course attendees, which by the way was a full house as expected, judging by this feedback alone, let alone my own instinctive feelings and response, all I can say is over the top. I mean, outstanding, outstanding. The detail is amazing. This entire protocol really requires a paradigm shift in order to fully embrace and understand the technique, the protocol involved. The devil's in the detail, absolutely, and I think we all experienced that with lecture discussion, but even more so the laboratory phase, the hands-on. That put it together quite well, as is true for most hands-on courses, but this one in particular because it was an all-day hands-on. So imagine 3 days, 2 days being lecture discussion, and 1 day just completely devoted to a hands-on series of exercises. That put it all together, I think, for all of us. So no question, an amazing protocol, and one that I think really should be looked at critically by anybody involved with implant dentistry. Absolutely yes. And does play on skill sets that require a good background in hard tissue involvement, soft tissue, and restorative as well. So this is truly an interdisciplinary approach, a protocol, if you will, a base protocol that kind of puts it all together for us to really look at cases very differently. I mean, for sure, myself included, after all these years, you know, you just when you think you're getting a good handle on pretty much so many things that you see over, in my case, 34 years, I can tell you that now I will look at some cases differently, and the approach that I've already begun to incorporate thanks to hooking up with Dr. Jose a few years back, now even more so I'm going to be able to apply more of these concepts and techniques into my day-to-day work, and then ultimately into my institute as well. So with that, I want to give a great thanks to these three tremendous clinicians, and encourage everybody to get involved with this concept. I'm very proud to say that not only did these gentlemen present as a team for the first time in the States, the IDR protocol, but they'll be returning next September right here at the Pikos Institute for not only a repeat of this level 1, if you will, course, IDR, but also for 3 days that involve the advanced course. And I know, judging by the feedback already from the attendees that just did leave here, roughly 15 of them have signed up already for the advanced course. So both courses will fill, no question, and we're most proud to host these first-class clinicians here at the Pikos Institute. Thank you.